see one another. So I'd like to now welcome our witnesses. From the Canadian Cardiovascular Society, we have Dr. Paul Dorian, Representative and Department Director, Division of Cardiology, University of Toronto. From the Canadian Health Coalition, we have Melanie Bernard, National Director, Policy and Advocacy. And from the Canadian Nursing Association, we have Michael Villeneuve, Chief Executive Officer. And finally, from Diabetes Canada, we have Russell Williams, President, and Kimberly Hansen, Executive Director, Federal. And coincidentally, this week is National Nursing Week, and 2020 is the 200th anniversary of Florence Nightingale's birth. So I'd like to take a moment to recognize all the nurses working so diligently in the face of this pandemic and who do critically important work every single day in all areas of care. So I'll start the opening statements with Michael Villeneuve, the CEO of the Canadian Nursing Associations. Mr. Villeneuve, please go ahead. 10 minutes, please.
Thank you very much, Chair. Can you hear me okay, Erica? Good afternoon. Thank you, Chair and members of the committee, for inviting the Canadian Nurses Association to appear today. Pardon me. I've worked in health systems for more than 40 years, 37 of those as a registered nurse, and I've had the honor of serving as the CEO of the Canadian Nurses Association since 2017. I'd like to acknowledge that I speak to you today from my home in Mountain, Ontario, which is the flattest place in Ontario, I think, despite the name, and that I speak to you from the unceded territory of the Algonquin and Anishinaabe people, and CNA House in Ottawa also sits on this territory, and we're grateful to be invited to share this space. There's more than 431,000 registered nurses, licensed practical nurses, registered psychiatric nurses, and nurse practitioners in Canada, the largest number of providers in our health systems. CNA is the national and global professional voice of Canadian nursing, and we represent 135,000 members across all 13 provinces and territories, and of course, many of our members also live in Indigenous communities. Wish I were speaking before you today about a less sobering topic, but that's not the world we live in right now. And as I saw it expressed recently, we went to sleep in one world and woke up in another. I know that the health and safety of the public and the nation's healthcare workers are uppermost in your minds and certainly in ours. And the pandemic clearly escalated broadly and as rapidly as a brush fire. And we must maintain our guard in supporting Canada's nurses and all healthcare professionals who are confronting and mitigating its impacts. We're in a situation unprecedented for all but the few who can still recall the flu pandemic of 1918 to 1920, and we've all been scrambling in response. The Canadian Nurses Association appreciates the measures that have been taken by all levels of governments across the country to tackle this problem and minimize the spread of COVID-19. And we've particularly benefited from the incredible and courageous leadership of our public health professionals, including the nurses who are so integral to that sector. We appreciate the strong communication from Dr. Tam, who leads the Public Health Agency of Canada, and we've had good communication back and forth with Health Canada, including with the Minister, and of course with Dr. Tam and her team at the Public Health Agency. We thank all of them as we thank you, members of Parliament, who are members of this committee. We speak with nurses all the time, and certainly very purposely each week we talk with them and poll them. And I want to take a few minutes to share with you highlights just of a few ongoing issues, and then I want to spend the last 5 minutes talking about a larger system issue that I think we need to tackle. So what are the ongoing issues of concern for nurses? You've all heard about personal protective equipment concerns, and 3 months into the pandemic, that still remains a bit inconsistent across the country. And it remains our position at CNA that those decisions around the use of personal protective equipment should be driven by evidence and the clinical judgment of the people using the equipment, and not availability or fear of shortage. So that's been an ongoing issue that seems fine in some places and less so in others. Second issue around testing, the WHO has urged for large-scale testing, but we realize that COVID-19 testing in Canada still falls behind some other nations, and nurses are concerned that without this information, the recovery efforts will not be informed by evidence. We're concerned about mental health right across society. This has been very scary. Nurses in particular are facing significant challenges to their mental and emotional well-being as a response of as a result of the COVID pandemic response and recovery. And we are continuing to advocate for access for all healthcare providers to mental health services at no cost to manage their emotional and mental health coming out of this. We're particularly concerned that just as many of us will have a chance to step back at some point, a little bit away when the pandemic settles, as we assume it will, or in waves, nurses and doctors and the people in the healthcare system are then going to have to pick up the backlog of all the undone surgeries and so on, and really be very, very stressed during that time. We're working with the Canadian Medical Association, the Canadian Institute for Health Information around determining the impact of COVID-19 on the health of healthcare workers. And we would urge governments to fund the tracking of that important data, which is a long-standing issue. Nurses, while they talk about concern about their own safety, one of the top issues they mention is vulnerable populations, and we're concerned about people who are more at risk for the spread and impacts, including many Indigenous people, particularly in remote settings, and people in congregate settings, such as prisons, shelters, and the homeless. My final point, before I speak about long-term care, is that given the lessons of history, we would urge a very guarded, evidence-informed, cautious, paced reopening of services across society. We're concerned that the virus is very much alive, still spreading, not well understood, and may well sweep across society in successive waves. We understand there's huge economic implications, but that has to proceed very carefully. Let me turn to a couple of larger issues that are really of concern to the Canadian Nurses Association and to nurses. Due at least in part to the very aggressive Flatten the Curve campaign, which Canadians have, by and large, taken part in, our hospitals have, in the main, been spared the devastation of our counterparts in China, Italy, the United States, for example. But at the same time, the pandemic has laid bare the crippling lack of standardization, funding, strong leadership, appropriate staffing, training, equipping, and so on of people who deliver services in long-term care and home care sectors. And these vulnerabilities have been well known for 20 years. As a result, just 20% of COVID cases in Canada are in long-term care, but they account for 80% of the deaths. And we understand this is the worst outcomes globally. While our health systems have many strengths, a series of robust investigations since 2000, things like the Romano Commission, have generated a now very familiar litany of places where we need to shore up. And we can name them all: pharma care, home care, mental health care, long-term care, and primary health care based on need and not on the ability to pay. And we're seeing some of those weaknesses play out now. The outcomes of COVID-19 in long-term care this spring are part the result of decades of neglect of that sector and a growing mismatch between the level of care required by the people who live there and the human resources deployed to care for them. Many of the patients, I told you I've been around for 40 years in the business. Many of the patients living in those nursing homes now with complex continuing ongoing conditions would have been in a hospital 20 years ago. And it's hard for people now to imagine that in nursing homes 20 and 30 years ago, people still drove their car to it, right? So those people now are managed in home care. And as we've shifted really complex care away, the response in long-term care has not been concomitant with the demand going in there. So the rising pace, volume, and complexity of care that's been shifted from hospitals to nursing homes also has coincided perversely with a decline in the proportion of regulated nurses in that sector. Fewer regulated nurses, fewer clinical educators, fewer social workers, fewer occupational therapists. It's a story of fewer and fewer and less, and it has a dramatic impact on the people working there who are largely unregulated and delivering 80 to 90% of the care. The workforce there is dominated by caring, loving, well-intended healthcare aides and support workers who just are not backed up with the sorts of professional nursing and other resources they desperately need. It's heavily dominated by women, often racialized women, who are paid low wages and often precariously employed. And you've heard the story. They have to cobble together 2 or 3 jobs or work a lot of overtime to make a living wage. And COVID-19 has just really exploited those weaknesses. In the final report of the National Expert Commission that CNA conducted in 2011-2012, we laid out 9 practical recommendations to address many of the same issues brought up by Commissioner Romano, Senator Kirby, and others that could drive better health care outcomes, better care, and better value for taxpayer dollars, and many of them have gone unheeded. If there's any silver lining in this, we have certainly seen that we can do things differently. We have flipped around primary care, for example, so that much of it can be done by telephone and virtually. We know that hospitals are partly empty because of canceled surgeries, but we see the emergency room wait list problem has declined, for example. Hallway medicine disappeared. And we believe that we have the capacity to address those problems and sustain those results. We can't go back because we know now we can do it differently. Meeting demands of older adults requires major changes to the health system and certainly some immediate attention to personal care assistance and nursing expertise in those facilities in particular. We have to reimagine aging in this country, including home care, institutional long-term care, end-of-life care, and then put those bold changes in place we know are needed. So to wrap up, I would say, I guess COVID-19 has shown us very strangely in the year of the nurse that nurses are an important force for delivering better health. And they've certainly shown that they're dedicated to the people of Canada, even when they're worried about their own health and safety. Clear information, adequate supplies, additional support for health system and its workers are needed, and they're going to be needed in the long term. It's not going away tomorrow. As the chair said, we meet today in the Global Year of the Nurse and Midwife during International Nursing Week and on the eve of Florence Nightingale's 200th birthday tomorrow. And perhaps ironically, after 200 years, we find ourselves talking like Nightingale. Wash your hands, clean the environment, gather good information to make your decisions. This week, we've set aside years of planned celebrations, as you can imagine, out of respect for the tens of thousands of nurses who are out there working at points of care this very minute, some of them even coming out of retirement to do so. They've answered the call. And so on behalf of CNA, let me close by thanking you for including us, and I ask that you place nurses in leading roles in the analyses of COVID-19 responses lying ahead. Listen to them. They have practical, smart information, and know that we will work with you to identify and deliver the best evidence to help governments and health systems make the changes that we need and implement real change. Thank you very, very much.
Thank you, Mr. Villeneuve. We go now to the Canadian